Hey everybody, welcome back to DYOR, Do Your Own Research. Today I want to go over and touch base with warning labels on medications. We've all taken medications from throughout our life at one point or another for one reason or another. But the question I have is, have you ever read the labels? Have you ever looked at the warnings on the labels? Have you ever considered what is in the medication that you take? For years, I used to do the same thing and just figured, oh, okay, it's accepted by society. Take an aspirin, take some ibuprofen, whatever the case may be. And, everything was good. But I believe that things have changed quite a bit with the people here in the United States and probably people around the world, that we're now no longer just taking it for granted and accepting the word of our government, our physicians, our medical field, when they say, oh, take this will be good for you, it'll be safe, it's tested, the result, we've got test results saying this is safe for you. But if you ever look at the bottles of medication you get and open up the labels or turn the bottle around and read the labels on your bottles, you're going to notice that there are warnings on the labels. So what I want to do is I want to consider just basically looking right now at the whole idea of, say, aspirin or pain relief in general. According to Merck, the Merck Manual for Medical Information, similar to this here, the physical book I have in hand, the Merck Manual of Medical Information provides, it says that pain relievers are categorized into three main types: non-opioids, opioid or narcotic, and adjuvant medications. Non-opioid options like acetaminophen and non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, are effective for mild to moderate pain and are often preferred due to low lack of dependence. NSAIDs also reduce inflammation, but long-term use may lead to serious side effects, including gastrointestinal bleeding, kidney problems, and increased risk of heart attacks or stroke. Not exactly a side effect I would like to have, excuse me, considering that I was only wanting to take away either some pain from an injury or a headache. When you consider the fact side effects of aspirin, as many times you'll find on the bottle label, you'll find out that the side effects of aspirin include upset stomach, heartburn, or indigestion. Of course, these side effects are, not everybody's going to get them because everybody is different. All human beings, their bodies are completely different, and we all react to medications differently. That's why medical professionals are called practicing, because they don't know for sure. They only know what they've been taught education-wise as far as the pharmaceuticals that they were trained on, not necessarily on the holistic side or the herbal side or the supplement side. But generally, the common side effects of aspirin include upset stomach, heartburn, or indigestion, easy bruising or bleeding more easily than normal, dizziness, ringing in the ears, tinnitus, or blurred vision. How many guys thought that blurred vision or tinnitus would be one of those things that would be a side effect of just trying to get rid of a headache? But there you go. Serious side effects, though rare, it says, can include gastrointestinal bleeding, stomach ulcers, intracorneal bleeding, bleeding in the brain, severe allergic reactions, kidney or liver problems, and prolonged bleeding time due to aspirin's blood thinning effects. I'm sure at some point in time many of us have heard about those effects. Acetaminophen, here's the side effects for that, are generally safe when used as directed, but it can cause side effects, especially in overdose or long-term use. Common side effects include nausea, vomiting, stomach pain, and loss of appetite. These are usually mild and temporary. Serious side effects, though rare, as they're saying, require immediate medical attention: liver damage, severe skin reactions, allergic reactions, kidney damage, gastrointestinal issues, and other issues. Under other issues, it says studies link long-term use to increased risk of heart failure, hypertension, and lower gastrointestinal bleeding. Interesting. Then the last subcategory of pain relievers that Merck lists is opioids. Opioids Side effects consist of constipation, nausea and vomiting, drowsiness and sedation, dizziness, itching, slowed breathing, respiratory depression. Less common but serious side effects are physical dependence and tolerance, opioid use disorder, overdose. Long-term use may lead to hormonal imbalances, weakened immune function, and increased pain sensitivity. My encouragement to you guys is every time you're considering any kind of a medication, whether it's something a doctor prescribed to you or whether it's something you're going to just get off the shelf at CVS or Walgreens or Walmart, that whether it happens to be like a supplement similar to this, or it happens to be a aspirin, or it happens to be an allergy medicine, even allergy medicine, my Lord, things that you would just take because you think you want relief from the symptom. Consider not only the symptoms, but the side effects, the long-term effects of those things. Do your own research in reading the labels and contemplating what you might want to do as an alternative. One of the things that I've looked at over the years has been not only alternatives to medicine, but supplements and things of that nature. My idea, my personal philosophy on it is prevent sickness and disease so that I don't have to take the medicines. And if I can prevent disease and sickness and don't have to take the medicine, and all I have to do at this point now is watch the signs of my body, eat right, stay healthy, exercise, and make sure that I don't overdo anything, because all things are good done in moderation, but overdone become harmful to us. So my encouragement to you is, no matter what you're contemplating as far as a relief of a symptom, find out where that symptom's coming from, find out what the root cause of it is, and if you can take care of the root cause of something, then you don't have to take a medication to deal with the symptoms and then brush over the root cause. Take care of the root cause and you get rid of all those symptoms, and then you don't have to worry about anything. So for today, that's my encouragement to you guys. Take care, and we'll see you again next time on DYOR. Do your own research.